Day 10 Clinical Task. You are assigned to care for 66-year-old Mr. Frolov who has had a right leg injury. You learn from his care plan that he had a fracture of the left hip joint. Yesterday, he had surgery replacement of the left hip joint. Answer the following questions about his care. What does replacement of a hip joint mean? Replacement of a hip joint involves surgically removing the damaged or diseased hip joint and replacing it with an artificial joint, typically made of metal, plastic, or ceramic components. This procedure is commonly done to improve mobility and reduce pain in the patients with severe hip arthritis or fractures. What is the position of the patient after surgery? The patient is typically placed in a supine position, like lying on their back, immediately after surgery. This position helps to minimize pressure on the surgical site and promotes proper blood flow. What position must be avoided after this surgery? The patient should avoid crossing their legs or bending their hips past a 90-degree angle after surgery. These movements can put strain on the newly replaced hip joint and increase the risk of dislocation or complications. What should be concerned or of caring for the patient? When caring for the patient after hip replacement surgery, you should be concerned about preventing complications such as infection, deep vein thrombosis, and dislocation of the new joint.